Good morning, and thank you for inviting me to talk about World Report on Vision. I am Dr. Michael Gichangi. World Health Reports are annual global health publications by World Health Organization. This has been done since 1995, and they talk about priority health issues. Also, they propose some interventions to the identified problems. In 1995, the World Health Report talked about bridging the gaps. The audience of the reports are usually policymakers, public health specialists, ministries of health, academic institutions, and others. The World Report on Vision was launched last year, 2019, on the World Sight Day. This was the first World Report on Vision. And this report, we see it as a guide to our actions at global, regional, and national level. It will also form tool for advocacy, especially when we have to put a case forward with respect to eye care and eye health. The overall aim of the report is to raise awareness of the global burden and impact of eye conditions and visual impairment, to identify effective strategies to respond to eye care needs, to take stock of progress that we've been able to make so far, identify main challenges facing eye care globally. Also, the aim of the report is to make a case that we should make eye care as an integral part of universal health coverage. We should make a case for integrated people-centered eye care as a best way to move forward. And the other aim of the report was to make recommendations that will be implemented by all countries to improve eye care. Generally, poor vision impacts negatively on the society, basically in productivity, in education, and we also see it impacting negatively in the transport sector, where we see more and more road traffic accidents associated with poor vision. As a matter of fact, everyone, if they live long enough, will experience at least one or the other eye conditions. And this we see much more in low and middle income countries, among the older population, more in women, and much more in the rural, disadvantaged, or marginalized communities. These are groups of people who have limited access generally to healthcare services. Globally, there are about 2.2 billion people with vision impairment. And out of the 2.2 billion, 1 billion are people who have visual impairment that could be prevented or are yet to be addressed to restore their vision. For example, cataract, unaddressed refractive errors, and even unaddressed presbyopia, which is accounting for about 800 million out of the 1 billion. There are some other eye conditions that do not typically cause visual impairment. For example, blepharitis, chalazion, allergic conjunctivitis, which take quite a huge burden of work and also absence from school and have significant economic impact, dry eyes, and so forth. Why are we seeing increased number of people with visual impairment or eye conditions? It's because the population is aging, and this is good because the life expectancy is going higher. However, we are also seeing diseases associated with non-communicable diseases, which are associated with the lifestyle changes, for example, diabetes and diabetic complications in the eyes. Taking a look at some of the diseases that are on the rise, age-related macular degeneration, we project that in the next 10 years, we expect about 50 million people globally increase with age-related macular degeneration. Glaucoma, which is the leading cause of irreversible blindness, we project that as at the moment, it is about 76 million, and we project that there will be an increase with about 20 million in the next 10 years. And so we have to develop strategies that will see that people living with glaucoma do not get into a situation of visual impairment. The World Report on Vision proposes this new strategy, which we are describing as integrated people-centered eye care. This means eye care in continuum from promotive, preventive, treatment, rehabilitative care. Then it also proposes that care should be both within the health sector and without the health sector or beyond the health sector. And the main focus in integrated people-centered eye care is the person and the person's needs according to his or what stage in life one is. The needs of a student are different from the needs of an adult who is working, and an adult who is working in an office has different needs from an adult who is working in the farm. For example, a disease entity like glaucoma, the report proposes that we should have a health promotive strategy or aspect, which include early detection of the disease, routine screening among the people who are at risk, for example, relatives of people who have had glaucoma and so forth. Preventive aspect, here we talk about prevention of further vision loss or prevention of vision loss. While treatment, we are talking about aims at reducing the raised intraocular pressure, use of eye drops, surgery, laser therapy as guided by existing national guidelines. So it is recommended that you have strategies in the continuum of care, promotive, preventive, treatment, and even rehabilitative. There are four strategies that have been proposed to see the realization of integrated people-centered eye care. One is engaging and empowering the communities to take eye health as their responsibility and priority. Two, reorienting to a stronger primary healthcare approach for health and eye health as a matter of fact. Then coordinating services within the health sector and across the other sectors. The other strategy proposed is to create an enabling environment, which includes ensuring that there are eye care plans within the national health strategic plans, integrating relevant data into the relevant eye health data into the health information system, and planning for eye care workers according to the population's need, where this is becoming important because we see most of the eye care workers in the rural, I mean, in the urban population, while the rural population, where there are more needs, have less and less of the workers. So we need to reverse that trend. And the World Report on Vision talks about ensuring that there are resources in terms of workforce, equipment, and infrastructure at different levels of care. At a community level, the needed resources for that, primary care level, secondary care, and tertiary care level. We have been able to accrue a number of benefits from previous several years, some success stories we can talk about that have emanated from strategies used before. For example, Vision 2020, we've been able to see a lot of benefits. For example, some diseases are on the verge of elimination, like glaucoma. We have seen more than triple the workforce trained. We have seen more than double access to eye care services in Kenya, for example. Also, we know that there has been several World Health Assembly resolutions focusing on eye care, and this has led to development of global action plans, which have eventually translated to national action plans and strategies. We have also been able to accrue and see a lot of scientific and technological development, which is impacting positively in improving access. For example, portable eye examination PIC, and then screening of diabetes retinopathy using fundus photography. These have been shown to increase access to these services more. Some challenges that we have to work on still is that one, the eye care needs will still continue to grow since the population is growing, and then the population of the older cohort is increasing. And these are the people who need attention in terms of eye health. Then the health information systems in our country and in this part of the world is weak. And so we are lacking the appropriate data for planning. And frequently we see that the eye care is not integrated very well into the health system, probably because of the fact that does not cause mortality. Now, the recommendations of the World Report on Vision include the fact that we must make eye care an integral part of universal health coverage. We should implement integrated people-centered eye care in health systems. We should promote high quality implementation and health systems research for effective eye care interventions. We should monitor the trend and evaluate progress towards implementing integrated people-centered eye care. And we need to raise awareness, engage the communities, and empower the communities about their eye care needs. Now, in the past 20 years, we have been using the framework of Vision 2020 to develop a global actions plan. And you know, Vision 2020 talked about the main three pillars: priority diseases, infrastructure and technology, and human resource development. And we've been using that framework for purposes of developing national eye health strategies. And so, moving forward, we shall use World Report on Vision to develop national strategies. And this way, we shall be implementing the recommendations of the World Report on Vision. Thank you very much.